Good morning, everyone. My name is Amy Nangia, and I'm currently a senior at Michael E. DeBakey High School for Health Professions in Houston, Texas. One of my main extracurriculars I'm involved in is epilepsy research at Baylor College of Medicine, and today I'm going to talk about youth-led solutions for environmental and health challenges. So let's get right into it. So here on the screen, you could see two images. One is a polluted beach and another is a misfiring neuron. So at first glance, what do they have in common? Nothing really. One is buried in plastic waste and the other is hidden deep inside the human brain. But both systems are overwhelmed by imbalance and both are waiting for intervention. Neither system collapsed overnight, but both showed warning signs long before a crisis became visible. And in both cases, the evidence is already in front of us. The real question is whether we have the data to fix it and whether we are willing to act on what we know. So this image on the left shows the change in global average temperature from 1880 to 2022 compared to 1881 to 1910 baseline average. Each bar represents how much warmer or cooler a year was than the early industry average. The blue bars in the early years show slightly cooler temperatures, while the orange and red bars in recent decades show increasingly warming temperatures. With this graph on the left, we can track rising temperatures in real time. We can map and track neural activity down to individual cells. The evidence is not hidden. The science isn't unclear. The data isn't missing. But the real question we need to ask ourselves is, what are we going to do with all this information? We often treat environmental issues and health crises as separate conversations. They are discussed in different departments and funded through different systems. But the human body doesn't recognize those divisions. Environmental conditions directly affect both physical and mental health. Heat waves can increase anxiety and stress levels over time. Air pollution has been linked to cognitive decline. Long-term environmental stress can influence how neural pathways develop and function. These effects don't happen in isolation. Rather, they reflect interconnected systems responding to shared pressures. When one system weakens, the others are affected as well. When multiple systems show signs of stress at the same time, it's important to pay attention. Rising global temperatures, increasing plastic production, and growing rates of anxiety and neurological conditions are all measurable trends. These patterns appear in different databases, but they move in similar directions. That parallel movement shouldn't be ignored, and it suggests that these pressures may be affecting all these systems at once. Correlation doesn't automatically mean causation, and we should be careful about drawing these conclusions too early on. However, consistent patterns across environmental and health data deserves serious investigation that we should further look at. Shared strain across systems often points to shared structural factors. Understanding how those connections allow us to move beyond isolated systems. If these trends are rising together, our response should also consider them together. When I started organizing beach cleanups, I thought I was solving a surface problem. I believe the goal was simple: remove trash and leave the shoreline cleaner than we found it. But as we kept returning to these beach cleanups, I began to notice something deeper. The waste wasn't really random. The same brands, same materials, and same items kept appearing. The repetition revealed patterns that led upstream to supply chains, packaging systems, and consumer behavior. The beach wasn't just the origin of the problem, it was the endpoint of a much larger system. Once I understood that, the cleanup felt less like the solution and more like data collection. In neuroscience research, we study patterns, neural firing rather than focusing on a single event. One neuron firing on its own doesn't really provide much information. What matters most is how networks of neurons communicate and coordinate over time. When that coordination weakens or becomes irregular, systems can begin to appear. Cognitive changes, mood instability, and these behavioral shifts can often reflect deeper imbalances within neural circulation. Treatment is rarely about fixing one isolated neuron. Instead, researchers and many clinicians look at the system as a whole and identify how these different interact. Restoring balance means improving communication across pathways and stabilizing network activity. The brain functions best when its systems are coordinated together and are stable. Under sustained stress, that balance can break down. Like environmental systems, neural networks depend on stability to remain healthy. 1% reflects small, almost invisible changes, the kind that almost feels harmless and the kind we mainly ignore. Systems rarely collapse in a single moment. They shift 1% at a time. 1 degree warmer, one policy delayed, one stressor added. The change feels small, almost invisible. Then one day it looks sudden. As ecosystems collapse, a mental crisis health erupts. But the collapse was never almost sudden. It was accumulated over time, and early intervention is always easier than emergency response. We are not lacking information. In fact, we are surrounded by it. Climate dashboards track temperature changes in real time across the globe. Medical imaging allows us to observe the brain with increasing precision. Research findings are published and shared more quickly than ever before. We have also predicted tools that help us model future outcomes. AI can help us analyze patterns across massive data sets. Scientists can help us measure trends in environmental stressors and neurological health with accuracy. The evidence isn't hidden or inaccessible. It is available to governments, researchers, and the public itself. The challenge today is not discovering more data. It's deciding how we use what we already know. Information alone doesn't always create change. Translation into policy, practice, and behavior is what makes progress possible. The gap between knowledge and action is where the real work begins. So one thing we can do is talk about digital fluency. We have access to more information than any generation before us. We know how to use digital tools to analyze and to share that data. That makes it possible for us to turn evidence into action. We can see patterns quickly and to respond in real time. We are connected to people and ideas across the globe, and this connection allows small ideas to grow into larger movements over time. Another thing we could do is plan for an urgent intervention. We will live in the long-term effects of climate instability. Rising temperatures and extreme weather will shape our future. Mental health trends are already affecting a generation. Healthcare systems are feeling increasing pressure. These challenges are not distant or abstract for any of us. They directly impact our lives and the world we are growing into. So, how do we turn data into action? Change doesn't always happen by accident or intention alone. It begins with understanding the problem itself and looking at what the evidence or information is. It requires measuring what is actually happening instead of relying on assumptions. And it also requires people working together across different roles and communities. And it also requires building systems that allow solutions to continue even after the initial motivation fades. So how do you do this? You could start local at a school board meeting or city council meeting in your hometown. Change often begins at a local level. Like I said before, schools, communities, and city governments are places where young people can speak and be heard. Local systems are where policies can sift more quickly. Small changes at this level can influence these larger systems over time and make an impact. So, lastly, I just want to leave you guys with a quote. Data can show us what is happening, but it cannot decide what we do next. That decision belongs to us. So we have climate reports, we have medical research, we have predictive models. Information alone cannot create change. It only becomes more powerful when it leads to decisions. Knowledge without action is just archived evidence. So if we have the data, what are we waiting for? We understand these patterns. We see the connections between environment and the health. We have the tools to analyze and respond. The remaining question is not whether change is possible, it's whether we are willing to move forward from awareness to action. Thank you so much. If you have any questions, my LinkedIn is on screen along with my Gmail.
Yeah, so I think that was a very important presentation, as in, I think all of us need to consider the impacts of these upcoming technologies like AI on things that can actually affect us, like medicine and biomedicine. And I've seen the prevalence of diseases like Alzheimer's disease, for example, which is not known to have any cure. And I could see that AI is currently working on it, and it can help streamline this and make a better future for us all. And also admire the community work that you're doing to actually help serve our community and impact it rather than just taking a passive stance. And I think that's exactly what EnviroCast Furthering the Future stands for. It stands for people like you who are actively striving to make a change, make a difference in the community, and are actually using this technology to actually help further the future, as in the name suggests. So I think Kaveen can start reading some questions.
So we don't have any questions yet in the chat. I think it was a very comprehensive presentation, so a lot of it was covered. We can maybe wait 1 or 2 minutes and see if anything is populating. I have put your contact information in the live chat though, so if anyone does want to access that, her LinkedIn and email is there. Let's see. Okay, we do have a question here from InspireX again. Here. How can AI help solve bigger medicine challenges like cancer?
I would say that AI can help us solve these medical challenges by detecting disease earlier through imaging analysis, personalizing treatments using like genetic data, accelerating drug discovery, and predicting these patient outcomes to improve survival rates later on. Yes.
Okay, for sure. Let's see. I think we're still maybe waiting on a few questions. Maybe people are still typing. But just to describe the presentation overall, I'd like to say it was very comprehensive, as in it considered both environmental and medical perspectives, and also evaluated, obviously, the big factor of how youth are shaping it, especially now more than ever. The increased possibilities for youth are really allowing them to do a lot more great things. So yeah. I think if there are no further questions, we can move on. But thank you so much, Amy, for the excellent presentation.
Thank you so much for having me.
There is always an opportunity to contribute to the discussions that we have at EnviroCast Geo. If you are interested in attending or even speaking at a future conference, learn more at geo.envirocast.org. We're excited to hear your insights.